Thank you for joining us on this very important program where we're going to be talking about Maternal and Newborn Child Health Week integrated with National Immunization Plus Days. Yes, we are talking mothers and children. So if you are listening, if you're a mother or a family man, I believe this program is for you and you need to sit down and pay attention to what our guests are going to be talking to us about this evening. As I said earlier, it is Maternal and Newborn Child Health Week integrated with National Immunization Plus Days. And I have in the studio this evening, by my right, I have Dr. Musa Milton, AFENET CDC State Lead. You're welcome on the program, sir.
Thank you so much.
And on my left, I have Dr. John Allah from the World Food Program. You're welcome on the program.
Thank you so much.
And viewers, you're welcome on this wonderful show. We're going to be talking for the next 1 hour. So stay tuned as we delve into the issues of maternal health and immunization. Don't go away. We'll take a break. And after that, the discussion will continue. Stay with us.
Borno State is conducting an integrated polio vaccination and maternal and newborn child health week from Saturday, 26th of April 2025. It will take place in all the 27 local government areas and will last for 7 days. During this special week, every child under 5 years will be vaccinated against polio and other childhood preventable diseases. Pregnant and nursing mothers are encouraged to avail themselves as other services which include antenatal care, postnatal care, family planning, tetanus vaccination, HIV testing and counseling, nutrition screening, and malaria treatment will be provided. Also, vitamin A supplements for healthy eyes, deworming tablets, and other health interventions will be made available at health facilities and designated posts. Don't miss out on these crucial services so that together we can build a healthier and happier future for our children. All vaccines are free, safe, and life-saving. This message is brought to you by Borno State Primary Healthcare Development Board, supported by World Food Program, UNICEF, and the CAWIS.
Thank you for staying tuned. And if you're just joining us, this is a health discussion on Maternal and Newborn Child Health Week integrated with National Immunization Plus Days. I earlier introduced my guest, but for the benefit of those that are just joining us, I have Dr. Musa Milton from AFENET CDC State Lead, Borno State, and I have Dr. John Allah, World Food Program. Once again, gentlemen, you're welcome.
Thank you.
All right, Dr. John Allah, I would like to start with you. What is the significance of this Maternal and Newborn Child Health Week? And why is it important that it is being celebrated?
Well, thank you so very much, and good afternoon or good evening to those at home. Thank you for joining us in this program. The Maternal and Newborn Child Health Week is a period where we prioritize the health and well-being of our mothers and our children. It is not the program that was just thought about yesterday. It's a program by the National Primary Healthcare Agency implemented in the 36 states of Nigeria twice in a year. And in this week-long activity, in this week-long program, the Primary Healthcare Development Board, working with partners, including the World Food Program, UNICEF, and other developmental partners, are putting hands together to provide free services for mothers and children to improve their health, and for some to make them recover from ailments, and give them an opportunity to healthy living as they go along. Thank you.
Okay, thank you very much. And talking about integrated national immunization, Dr. Musa, I would like you to talk generally about immunization. Why immunization?
So immunization, first of all, I want to say is one of the most successful public health intervention globally. Okay. And why it is important for us to ensure that our children are vaccinated and are covered with vaccines is that there are some diseases that are called vaccine preventable diseases. Okay. And these vaccine preventable diseases means that a child must not come down with those diseases. Once we get them vaccinated, we provide them that opportunity, they will all be covered and protected from those vaccine preventable diseases. And of course, one of the biggest ones that has been marked for eradication globally, what that means is to say, at the end of the day, no child in the world will be infected by a polio virus.
Okay.
So that's why it's that important.
Okay, thank you very much. And talking about the Maternal Health Week, what are the objectives of this week?
Indeed, thank you so very much. The objective, like I stated earlier, is to provide very key, scientifically proven, cost-effective interventions free of charge to mothers and children in primary healthcare centers that are in their communities, in their wards. Interestingly, the flag off of the campaign, as was showed in the adverts, happened in a very interesting community in Jere Musari Primary Healthcare Center. I was there myself.
Okay.
The facility is right within the community where people can access. So that is where the service will be made available. And these services, we encourage mothers to really go and access them. The objective is to make them access these services for their own health and well-being.
Okay, thank you very much for that. I hope mothers are listening and taking advantage of that. Now, you talked about the importance of polio vaccination. What is polio?
So polio is a viral disease, and I want to also make sure that everybody understands that viral diseases cannot be treated.
Oh, it cannot be treated.
It has to be prevented.
Okay. Okay.
So that's why poliomyelitis is a very dangerous disease. That we don't talk about treatment, we talk about prevention. And viral diseases cannot be treated. Once a child's hand or leg is lost to a viral infection caused by polio virus, that is irreversible, and that child will live with that disability. So it's so important that we know that poliomyelitis, that's the name as it is called, shortened to polio. Everyone needs to know that it is a very dangerous disease. And that's why we are taking it serious. And that's why the government of Borno State, the government of Nigeria, and governments globally are taking the issue of polio eradication as an emergency.
Okay, thank you very much. Now, Dr. John, what are the services available for mothers and children during this week?
I must say that, thank you again, I must say that the services are those that they already originally assess in these services, but sometimes pay for them. So it includes things like the antenatal care, postnatal care, long-lasting insecticide-treated bed nets. That one, if I could access it right now, I'll be very glad. You know, I was at antenatal with my wife just on Sunday, and I'm a doctor, and the doctor kept reminding me, please let her sleep under a mosquito-treated net and insecticide-treated net. And she's a nurse. My wife is a nurse. So imagine how important it is for us as health professionals to use these services. So in addition to that, we have neonatal care for the newborn. We have immunization, anti-malarial drugs. We are coming to a season where we expect an increase in malaria cases, so you could go there and get screened for malaria and get treated. We have health education, deworming, very crucial. You know, we have iron and folic acid and many other interventions for this week-long program. And I will repeat, they are free of charge for 1 full week. Imagine they say 1 full week, these health services you have available in the health facility, you can go and access them free of charge. If I was anyone, I would run to the clinics that they offer the services. And
you are assuring us that all these clinics are equipped with all the services you mentioned?
I will repeat, it's not the primary health, it's not the public or what you call the private clinics. It is the primary health care centers all across the 27 local government areas. I got that number correct?
Yes,
27 local government areas of Borno State, free of charge.
All right. This is an advantage, is a privilege for mothers that cannot really afford some of these things to run there. Like he said, you run there and get it. Now, Dr. Musa, who are at risk of this polio disease that we're talking about?
So it's good to put it very clear that the polio virus does not segregate who to infect.
Okay.
Yes. So what it means is that it can infect an adult of whatever age. However,
an adult?
Yes, it can infect an adult.
Okay,
however, The issue is the most affected age group is the age group less than 5 years.
Okay.
And it can also extend beyond 5 years to 15 years of age. All children less than 5 years are at the highest risk
of the infection.
Of infection by being infected by polioviruses.
Okay.
While up to age of 15, they can be affected as well. But like I said, the virus can infect every human being that is alive because the virus does not segregate. However, we are focused on children less than 5 years of age because they are the most affected age group. I can tell you, in countries where the polio virus has been eradicated, adults are vaccinated against polio viruses so that it is not imported into their country. So if you are going to Saudi now, you get vaccinated by an oral polio vaccine so that you will not carry the virus from where the virus is found to a place where the virus has been eradicated. So the polio virus affects all age groups, but is most critical in under 5 children.
You know, I'm curious about adults being infected. Why would an adult, after growing and all these childhood diseases, he has outgrown them, and then an adult, is it because he or she was not vaccinated while young?
Of course. So if a child is vaccinated and he gets this lifelong immunity, because there are different vaccines we use, and I will of course speak about those vaccines as we go on. But the key is that every child that gets vaccinated gets this immunity and is protected. So as you grow older, you get protected. But the biggest challenge we are having is that there are many people who have been avoiding these vaccines, and that is why you can have an adult who has grown through the system of the primary healthcare system without getting vaccinated, becoming infected, and then transmit the virus without showing symptoms of the infection.
So how is this virus transmitted?
So the virus is transmitted through what we call fecal-oral. The virus is taken through the mouth, infected food, infected water, dirty environment, goes into the stomach, then multiplies and is passed out through the stool. And anyone who gets in contact with that infected stool and comes back and maybe eats, and then the virus can be transmitted. So most likely more children get infected with the polio virus than adults.
Okay, because of their
hand hygiene
and all that.
Yes.
Okay, that's interesting. So adults are not left out. Maybe if you have not taken it and you say I've grown, I will not have any problem with polio. The doctor is saying it today that even adults can get infected. So one needs to be very, very careful and all. Now, still talking about maternal and newborn, you know, always when you bring a medical personnel on air, it keeps talking about exclusive breastfeeding and other vitamins for children. Why is it important that a mother exclusively breastfeed her child? And then I would also want you to talk about the vitamin supplements and the deworming supplements that we have for the children.
I think very crucial is to first of all define what exclusive breastfeeding is, so our viewers will understand when we say exclusive breastfeeding what it means. Exclusive breastfeeding means providing your newborn from the first 30 minutes to 1 hour of birth breast milk up till the child becomes 6 months without an introduction of water or any other food items within that period. And anything that you give to the child that period should be prescribed with reason. Okay, even if it is drug, it has to be with reason. And of course, then there is continuation. It doesn't mean at 6 months you stop, then you continue from 6 months until the child becomes at least 2 years.
Breastfeeding.
But exclusive breastfeeding is what covers from birth to 6 months. But the child should continue. The word is at least 2 years. Now, because you're a lady, you're wondering, you have sacrificed me for 2 years, right? That's why. 9 months. So now let me tell you the importance. You know, the importance of exclusive breastfeeding cannot be overstated. First, it is important for the child, and then for the mother, for the family, for the community, for the nation.
Okay.
The importance is that wide. Yes. So for the child, first, it is the most important meal the child should have. Agreed. From birth to the child turns 6 months. It has all the nutrients and all the ingredients the child needs. You don't need to cook it. So that's going to the importance to the mother.
Naturally
but also
cooked.
to state, speaking about vaccination, it is the first immunization the child has.
Okay.
That first breast milk called the colostrum, and of course the other milk that comes later are important. They contain what they call maternal antibodies. So it's like transmitting the strength of the mother to the child. So the child doesn't need new strength. As they're giving birth to the child, they are breastfeeding the child. The child receives the mother's strength. That's as simple as I can explain it. So that the child is able to withstand diseases and infections even as a child and growing up. Importance for the mother is, we are talking about family planning. That is a good family planning strategy. During the period of exclusive breastfeeding, the likelihood of getting pregnant again is lower. So that means the woman can rest her body before preparing for a next pregnancy. Interestingly, people don't realize that you need to prepare for pregnancy. Pregnancy should not just occur. You need to prepare for pregnancy. So breastfeeding delays pregnancy. It has that contraceptive function. But also for the family, it is cheap and free. You don't have to do anything for it.
You don't have to go buy.
You don't go buy food or whatever. I mean, now with the current cost of things in the market, if you go and buy formula food, you know how much you spend. But breastfeeding comes natural. In fact, the mother's body begin to adjust towards the end of pregnancy or during pregnancy throughout, but towards the end of pregnancy, milk is already ready for the child. So it is that important for the nation at large. Economically, it's important. You cannot overstate it. Economically is important. It saves, it in itself, you avoid using any other thing to feed the child, and so the risk of transmitting infection to the child is lower, and therefore even the need for health services is lower. That means you're saving stress on the health service, you're saving costs that would have been used to treat the child. You know, a lot of benefits. I can't overstate them. Speaking about vitamin A is very crucial for a child's immunity. Why we use vitamin A supplementation here is because it needs to be added on top of what the food that is already taken. Okay, because we realize the combination of food that is taken a lot in many households doesn't provide sufficient vitamin A for the child. And so that's why it's important that they are supplemented, and there's a regimen following the national program on immunization. And deworming is crucial because of the environment we're in. Worm infestation can happen, and the consequence of that is anemia, because there's called worm caused anemia. Anemia means blood shortage. So to avoid blood shortage, you deworm. So those worms that are preventing absorption of nutrients and all that, when they are taken away, absorbing nutrients is better, your nutrition improves, your immunity improves. But about breastfeeding, I can't overstate it. Please ensure you breastfeed your child exclusively. It is, I will agree with them, it's not easy, but it is worth it.
It's worth it. Okay, but talking about vitamin A and deworming supplementation, at what age should a parent start the vitamin A?
Vitamin A supplementation starts from 6 months.
Okay, from when the child starts meals.
Yes, 6 months. There is a regimen of 6 months. You can correct me. 6 months, 9 months, and then 9 months. 9 months, and then for deworming, of course, the same thing. You shouldn't give albendazole or mebendazole before 6 months.
Okay, but a child, once a child starts taking external meals, the deworming can start?
Sure.
You want to add something on that?
So it's good to emphasize that immunization and nutrition interact at every point, and thank God we did this integration. What we are saying is we all work for the same thing: the health of the child, the health of the mother. Once a child begins to take his immunization and is being breastfed, that child is protected almost through life. There's proper connection, there's proper health, and we also are demonstrating on the field that we are working for the same objective. So immunization and nutrition interact from the beginning of the birth of the child.
Okay.
Yes, so the protection that the mother gives through the colostrum is what protects the child against certain diseases. For example, measles. Measles is given at the age of 9 months. So before that 9 months, the child is depending on the colostrum, the immunity that of the mother that the child gets from the milk.
The breastfeeding.
Yes.
Okay. Okay, so back to our questions on polio.
Yes.
Earlier you talked, I think, let me say briefly about the spread
of
poliomyelitis, but I want you to elaborate How does it spread?
So typically, the polio virus is found in the guts, in the stomach of an infected person.
Okay.
And it can be passed into the environment, into a stool. When somebody passes his stool in a dirty environment where open defecation is happening, and this virus can now be picked and be brought back into the house, and then contaminated food, contaminated water. That is how the virus gets transmitted across from one child to the other. But if a child is vaccinated and immunized with oral polio vaccine, when the virus enters the stomach of the child, it will already find the vaccine already to have given that protection that the child needs. So at that point in time, the child is protected, and that virus now dies off.
Okay.
Yes.
So from what age is the child given polio?
So we have two types of, two ways we vaccinate. One is what we call routine immunization. The second one is what we are discussing today.
Okay.
So routinely, once a mother gives birth to a child, 24 hours after birth, the child gets his first doses of vaccine: hepatitis B, oral polio vaccine, and BCG.
So it is expected that in every hospital,
in every health facility where a child is delivered, that child should get vaccinated within 24 hours. Yes.
Okay.
Of course, that is where the child starts from. And then 6 weeks, the child gets another dose of polio vaccines. 10 weeks, the child gets another dose of polio vaccines. And then 14 weeks, the child gets another dose of polio vaccines. There are two types of polio vaccines. There's the inactivated polio vaccine, which is injectable, and then there's the oral, which we usually just give 2 drops in the mouth. So a combination of these two gives the child a protection that is lifelong, and the virus is eliminated completely and eradicated.
So it serves as a shield.
It serves as a shield for the community and for the children. Currently, only 2 countries are struggling with the wild polio virus, and that's Afghanistan and Pakistan.
Oh, thank God Nigeria is not in it.
Nigeria is not in that for now.
And we hope it stays that way.
Thank you.
With the work you're doing and all that. Now, you know, we talked about exclusive breastfeeding, and there's a lot of talks surrounding exclusive breastfeeding. This area is hot. How can only breast milk satisfy a child and all that? So can you talk to us about the common myths and misconceptions of breastfeeding?
You just asked one. The place is hot, and so they feel the child gets very dehydrated and the milk will not be enough. Interestingly, most content of the milk is water. So all the water the child needs, you just need to increase the frequency of your breastfeeding. It is advised that you breastfeed at least 8 times in a day, at least twice at night, amongst that 8 times. That's the recommendation. And breast milk, what people do a lot is they just breastfeed and for a short period and drop. So the breastfeeding practice that is good for the child is you start, you continue until the child falls off.
Okay.
So it's not used until you are tired. It's not about the mother's tiredness.
So until the child
falls off,
leaves the
breast milk. Because there are 2 layers of breast milk. There is the foremilk and there is the hind milk. The hind milk is what contains nutrients. The foremilk contains more of water. So if you breastfeed and the child falls up too quickly, or you stop too quickly, most times it's just water the child received. And you see how water is available already for the child. You don't need to bring the one from the fridge or pure water or whatever to give the child. It's already there as if it's what God has arranged that is the first thing that the child gets. And then the hind milk brings all the proteins, the carbohydrates and fats and oils that the child requires. So on the hotness of the environment, of course, you should try as best possible to stay away from conditions that would dehydrate you, but the breast milk by itself will produce or provide sufficient water for the child. Another myth and misconception is that the colostrum is that yellowish one, the first milk that come out. People think is a bad milk. Some even call it iska. That is but it's not. It's a very important, in short, one of the most important part of the milk for the child, and it contains a lot of antibodies. Antibodies are protective proteins in the milk that protects the child from disease. So it's important to give that first milk. Some people throw it away. I've seen it physically. They just express it and throw it away. No, it is crucial and important for the child, and is important. The other myth is that if the mother is malnourished or weak or something, she will not be able to breastfeed. That's not true. So all you need is try and help the mother feed well and all that. But even if a mother is ill and all that, she can still breastfeed.
Even when she's ill.
Yes.
Okay, thank you very much for that. And I hope we are getting it, especially that misconception. Now, we've been talking and we need to go on a short break. When we return, our doctors are still here to talk more on child nutrition and immunization. Don't go away.
Gwamnatin jihar Borno za ta kaddamar da gamayyar rigakafin cutar shan inna da kuma bikin makon jarirai game da sauran batutuwan da suka danganci iyaye masu shayarwa daga ranar Asabar 26 ga watan Afrilun shekara ta 2025. Za a shafe tsawon kwanaki 7 ana gudanar da gangamin a dukkanin ƙananan hukumomi 27. Yayin wannan mako na musamman kowane yaro dan ƙasar shekaru 5 da haihuwa zai samu rigakafin cutar shan inna da sauran cututtuka yayin ƙuruciya. Kazalika ana ƙara azama ga mata masu juna biyu da kuma mata masu shayarwa da cewa su kasance cikin tanadin da aka samar da suka hada da mata masu zuwa awo da kuma samun kulawa bayan haihuwa gami da tazarar haihuwa da rigakafin cutar tetanus gami da gwajin cutar na mai kare garkuwar jiki wato HIV da ba da shawarwari gami da tantance nau'ukan abinci da kuma samar da kulawa ga cutar zazzabin cizon sauro wato malaria. Har ila yau an samar da sinadarin vitamin A domin lafiyar idanu da maganin tsutsan ciki da kuma sauran bukatun yau da kullum a bangaren kiwon lafiya tuni aka samar da su a cibiyoyin kiwon lafiya da aka tanadar. Kada wannan dama ta kwace mana, don haka akwai bukatar mu hada karfi da karfe domin sake gina makomar ingancin 'ya'yanmu. Dukkanin rigakafin kyauta ne, kariya da kuma inganci. Wannan sako ne daga hukumar lafiya matakin farko ta jihar Borno, World Food Program da UNICEF gami da Zeka Wiz.
Thank you for staying tuned on the program. If you're just joining us, this is Maternal and New Child Health Week integrated with National Immunization Plus Days. We are having a discussion about the week. Before we went on break, the doctors talked about the importance of this week, where Dr. John made emphasis that it is a privilege, or that is advantageous to mothers to come to every healthcare facility to access these services free of charge. And Dr. Musa Milton also talked about the essence and the significance of immunizing our children, especially against polio. Now, before we went on break, you talked about the myth and misconceptions of exclusive breastfeeding and generally breastfeeding. Now, I want to, many times, Dr. Musa, you hear, especially in this part of the world, where people feel vaccination is a way of either reducing our population or sterilizing the children so that we will not have many children and all that. Can you correct this misconception?
So it's good to put it on the record that we've been vaccinating with polio vaccine since 1988, going from house to house till date. The population of Nigeria has been growing. The population of the world has been growing. So the myths and this misunderstanding that vaccines can stop a person from giving birth is not based on facts. It is not scientific. It is not having any base. So as far as we know, that when you take your vaccines, you only get protected. And like I said, we have two sets of vaccines. There's the one we call routine immunization, and of course the other one is what we call the National Immunization Plus Days. For the routine, you go to the health facility and take the vaccines. For the National Immunization Plus Days, we go house to house and make sure that all children get 2 drops of oral polio vaccines. And we've been doing this across the world. It is not only in Nigeria. And we've done it just this week. We are concluding towards the weekend. We have 2 days remaining, today and tomorrow, for children that we have not been able to reach. We are going to make sure that we reach them and they get vaccinated. So vaccines are safe. vaccines are good. Every child should be vaccinated.
Yeah.
We also have adult vaccines that we expect adults to also take, like HPV vaccine for young girls.
Yeah, for
Yes.
young girls.
Yes, for young
and
girls.
are those vaccines free for young girls?
All vaccines in Nigeria are free. The government of Nigeria provides it free.
And available.
And they are
in week. What are the services or the services that are being offered to mothers to make them strong so that they can give their children the required breast milk that we're talking about, especially the pregnant women and lactating mothers?
Yeah, thank you once again. Now, very importantly is the antenatal care, and antenatal care cannot be overemphasized. Antenatal care is one of the most life-saving interventions you can give a pregnant woman. Like we will say, every pregnancy is unique. No two pregnancies, because you have carried pregnancy before does not mean the next one is the same. As every child is unique, they come with unique faces. Even when they are twins, they can still be different. Their DNAs are not the same.
Yeah,
that is how every pregnancy is unique, and the trouble from each pregnancy is unique. So antenatal care does a job that it identifies problems early and then helps us to intervene early. And this is one of the services we receive in this week-long program. Another one is also, of course, when you give birth to a child, you need to register the child. It's one of the things that's missing. A lot of children don't even know. In short, even adults have estimates of their birthday. They don't know their birthday, and it is crucial.
Birthday.
It is crucial that they know their date of birth. At least let them be able to celebrate a birthday, right?
That's
and
right.
then, very importantly, is linked to the antenatal program is the iron and folic acid, crucial for ensuring that they have enough blood in the system to support the baby and support breastfeeding. But also they will receive nutrition screening even as mothers. They'll be screened for malnutrition, and we have, as WFP, we provide pregnant and breastfeeding women with supplements in case they are malnourished, particularly in LGAs in northern Borno. And then we have child spacing information. Like I said earlier, after a pregnancy experience, the body needs to rest. Her body needs to rest, recover before preparing for the next pregnancy. So we will have that child spacing education. We will also have long-lasting insecticide-treated bed nets, another very effective way of preventing malaria, particularly now the rainy season is coming. It's not during the rainy season you start chasing your husband or chasing this one around that you want your mosquito net. This is an opportunity for you to go to the health centers, the primary health care centers, to access them. We also have anti-malarial screening and medication, and also health education for the women that access these services. There are a lot more, but I want to stop here. Thank you so very much.
So during this week, all these are free, but after the week?
Well, I would refer you back to the Primary Healthcare Development Board, but a lot of them still remains free. For example, nutrition services. I mean,
especially for pregnant women that will have to be going for antenatal care.
It's free.
You know,
it's free.
Okay, it's free for pregnant.
It's free for children and pregnant women.
That is interesting.
Care is free, except where it is a private health facility.
Okay, except, and it's only if you want to visit a private healthcare facility, I guess. Hospitals I know are equipped. The state government is really doing well in the area of health, and with the help of the partners.
Sure.
Okay, that is very beautiful, and it's a nice job you're doing. Now, talking about immunization, why the repeated? Why do we give it repeatedly?
Yes. So like I said earlier, there were three countries before 2020. That was Pakistan, Afghanistan, and Nigeria. And we did a good job. And I want to also say that it was Borno that was the last.
Wow.
And we did very well.
That's commendable.
Yes, that's very commendable. And what we have done is that we have stopped the transmission of wild polio viruses in Nigeria, including Borno.
Congratulations.
However, if Pakistan has a virus, if Afghanistan has a virus, the virus can be imported.
That's right.
International travel is so quick now. Within 24 hours, 48 hours, you're in Pakistan.
That's right.
Another 48 hours, you're back to Nigeria. and so that virus can be brought back. So we need to continue to vaccinate until those countries have finally stopped the transmission. Again, we have a variant that is not wild, that is circulating in Nigeria, and that's why we are also vaccinating. So we have these two reasons: importation, and then the one that we call a circulating variant poliovirus that is found in the environment. It circulates from amongst children that are not vaccinated. So that's why we are continuously urging parents and caregivers to accept vaccines. Let's do Nigeria, let's do a good job, and let's make sure that that virus goes. And I can assure you that where vaccines go, the virus will die.
Yeah, thank you very much.
Thank you.
I believe we'll all join hands together
to work
towards that. We have done it,
we
can do better.
We can do more.
Thank you so much. Yeah. Now, Doctor, we talked about antenatal care. I want you to talk to us about the benefits of postnatal care and family planning.
You know, for postnatal care, a lot of women think after they've pushed the baby or they've removed the baby, it's over. No. The first 6 weeks after delivery is another danger period.
Okay, for the mother.
For the mother, she needs to be monitored.
Okay,
until she gets out of what they call the puerperal period. Sorry for the big grammar. It's the period just around delivery. Okay. Yeah. I was talking to a neighbor a while ago, and after delivery, they went home, and 3 days later they had to go back to the hospital with the child. Okay, but if they had been patient until maybe they are discharged.
Okay,
properly.
Maybe after 24 hours.
After 24 hours, or until they are properly. You know, some people after they deliver, they want to go quickly.
Immediately.
So it's not until the health worker said it's okay to go home. Okay. But also after going home, the date they give you to return for postnatal is crucial. There are a lot of things. For example, there is postpartum bleeds. Okay, that could occur. You, as a woman, you may not recognize it. I was in the teaching hospital where I was trained. There was a woman that delivered, and nobody knew she was bleeding until she had collapsed, and they shifted her. She was in a pool of blood, but graciously she was in the hospital at the time, and we were able to respond immediately. So if they don't go for postnatal, some of these dangerous signs or danger things post-delivery will not be identified. But also, the routine medications that they give them, the iron and folic acid, is something they should continue because they need that support as they are breastfeeding the child. The mothers need support themselves. It's not only the child that we say breastfeed them. We also know that the mothers need support in terms of counseling, in terms of receiving their routine medication, and a lot other things that they will assess in the postnatal period. But also, you spoke about family planning. Family planning, I know, is a very big issue around here, very difficult to talk about, but it is crucial. It is crucial. Those that are doing it know the benefits. So go and ask those that have been doing it and find out their benefits.
It's actually beneficial.
Indeed. You know? So it is very beneficial that you plan your family, you space properly. That way, in the current context of Nigeria's economy and the global economy, it is even more needed that you are able to care for the children that you bring into this world, but also the children also can enjoy their mother for the period. Because I've seen situations where as the mother is still pregnant and she's breastfeeding and is still pregnant. That means that one that is breastfeeding would receive lesser attention while they're expecting this new one, and that's not fair on the child. So family planning is crucial for both the mother and the child.
Okay, thank you very much, Doctor. I'll come back to you on this issue of family planning, but before then, I would like you to talk to us about the challenges that you experience especially during this campaign periods. I'm sure there are challenges.
There are challenges.
So talk to us.
So some of the biggest challenge we have is there are some parents who, because they don't have enough information or for some reasons that they best know, sometimes the reasons are not really related to health, they say we don't want the vaccines. And that's the biggest challenge we have. And that's why we are on this program now. We want every mother, every father to hear that vaccination with polio vaccines is safe. They should let every child be vaccinated. The government of Nigeria, the government of Borno is doing a lot to educate parents and caregivers. Community leaders have been engaged to talk to even select the teams that will vaccinate, so that they know that the vaccinators are coming right from their own children, so that they know also that no one will come with any vaccine that will harm them. And the government of Nigeria makes sure that everything is safe and they can get vaccinated. So the biggest challenge is rejection. Of course, we have other challenges like hard to reach areas, but I can assure you, security compromised areas, I can assure you that the State Primary Healthcare Development Board has come up with strategies for reaching areas that are very far, and areas that are hard to reach, areas that are nomadic settlements. We have all mapped these areas, and there is no LGA in Borno where these vaccines have not reached, including Abadam, including Guzamala, including Marti. So we take these vaccines everywhere. So barriers that we have, most of them is distance, sometimes hard to reach areas, insecurity, but we develop strategies and design them by the leadership of the state government to ensure that vaccines reach every child that is living in Borno State, and not only in Borno State, in Nigeria as large.
A quick one. Can a sick child be vaccinated?
Sure. A sick child can be vaccinated with oral polio vaccine, depending on the sickness. Actually. So if a child has very high fever, that we can wait till the next day. However, almost all children, if it is a fever that is just occurring and it's not so high, the child can be vaccinated. So polio vaccines do not have any contraindications that we should be afraid of. There are some vaccines that have some contraindication, but polio vaccines are safe even for a child that is running fever.
Okay, thank you very much. And that is good to hear. So for parents that feel my child is having fever, I will not take it.
It's better to vaccinate than to lose a limb, than to lose a hand.
You have heard it from the horse's mouth. I'm not the one saying it. The doctor is saying it. Now, I said I'll come back to you on the issue of family planning. Just like the myth and misconceptions of breastfeeding, exclusive breastfeeding, taking immunizations and all that, people feel if I do family planning, let's assume you have just a child and you want me to space, and probably I want to go for family planning, and you hear older women telling you that no, you shouldn't start family planning. What if you stop giving birth completely and all that? You hear that a lot. So what can you say about that?
Now, I understand particularly in Borno States, I understand the cultural dynamics and religious dynamics around here, and how that in itself can be a factor in people's deciding, just the same way with vaccines, in deciding to go for family planning. But the word itself, planning, is never bad.
Planning is not bad.
There is no planning that is bad. Okay, in short, people say if you don't plan, then you plan to fail.
That's right.
Right. So, in the same way, if you don't plan your family, you might be planning to fail. And family planning is not just about birth spacing. Family planning is about planning a family. You know, and it means that for every child that is coming, you plan. You may not have all the resources for them per se, but there is a plan. It is sort of intentional. It shouldn't be accidental. You know, but even at that, we know there is no accidental child. There is never an accidental child.
You only have an unplanned.
Yeah. Okay, so but it's important that your children are really indeed planned. Okay, and so that at the end of the day, none of them, because what we find in some societies and communities is that the children are there and then they don't have the opportunities. I was in the general hospital one of these days providing services as a doctor, and a family came to me that this is their 12th pregnancy, and they were very uncomfortable. It is not because it's 12th and they are happy. They were uncomfortable that it is 12. The history was that they have 9 children alive. That means the other 3 that are no longer alive, right? And then this is now the 12th pregnancy. You could see the dissatisfaction on the woman's face.
Okay.
It was not even the woman's body. You could see that she was tired.
She was not ready for.
She wasn't. She was not. I mean, a 12. Do you know what it means for the womb to go 12 times? And this is what family planning helps you do. And listen, for the women, it is your body. I know you're married to your husband and all that, but you are the first custodian of the body. And you can suggest to your husband, say, please, I want to give birth, but please let us organize. Let us organize. The way you organize money for feeding, the way you organize your home, the same thing you must organize for the woman's sake. The woman is crucial, is important, and she needs, the one that are giving birth to need to be taken care of.
Definitely.
Okay, and that's what family planning helps us to do. And in this MNCH week, much more information about family planning will be provided, because it is not just about we telling you, we also need to hear from you. What are your thoughts? What are your opinions? And then so that we can guide you. If you want to get 20 children, fine, but let us still guide you.
Yeah. Okay, but are there side effects? You know, sometimes for some, they have to take the pills and what have you. Are there side effects to that?
So then family planning now comes to the other thing about contraception. Now you're going into contraception. It is a part of family planning. Some people think when you do family planning, it is stopping pregnancy. No, family planning is not stopping pregnancy.
It's planning a family.
Yes, planning a family. So pregnancy arrangements, which also includes deciding when to be pregnant or when not to. Interestingly, my elder sister, who has 3 children, called me the other day and said she's going to renew her implants. And I said, oh, you had it since? I said, no wonder no child came after the last child.
But you know, it's difficult to just stay without the contraceptives and then not take in.
It's almost as long as man and woman has activity, it is almost impossible.
Thank you.
Okay, as long as they are fertile, they are healthy, they are okay.
So it means the contraceptives must be there.
That's what I'm saying. Planning. It's a part of it. So what happens is, it depends on what is your plan. It's like MTN. You have this telecommunications agency. You have a data plan. You want 10 gig. They will not tell you how much. You want 20 gig. They're not asking for how long, for how much. Right? The same thing. You want you want to stay away from pregnancy for how long? Okay, you want to space your children for how long, so that they cannot recommend which type of contraception is needed, and then they will provide you information on the side effects.
Okay.
And then how long is it from stopping that contraception will you get pregnant? It's like a likelihood. Okay, and it's a lot of factors, but in that in the clinics, they will provide you a lot more information and guide you into making your own informed decision. Nobody will impose decision on anyone, but it is about receiving the right information to decide for your own self how you want to plan your family. I will end on this note. No planning is bad planning. Every planning is good. Even if the plan does not work, it is still good to have planned.
There was a plan.
Yes.
It's just that it failed.
It fails.
Thank you very much, Dr. John Allah. Now, Dr. Musa, still talking polio. Can a child get polio after being vaccinated? Is it possible?
It's not possible.
Oh, completely.
If the child is protected. So there are 2 words here. One is vaccination. The other one is immunization.
Okay, there's difference.
There's a difference.
Okay.
There's a little difference between these 2.
Okay.
The act of delivering the vaccine is called vaccination. The child converting the vaccine to immunity is immunization. So it's possible to vaccinate a child, and if the child has any condition that will not allow the child to seroconvert that vaccine into immunity, then that child can get infected. And I give an example. If a child is malnourished, the child can take the vaccine, and because the child is not well fed, the child is malnourished, the child will not seroconvert from vaccination to immunity. So that kind of a child can get infected.
Can get infected with the virus. Okay, thank you very much. Now, you're still watching the program on the maternal and the newborn Child Health Week, which is integrated with the National Immunization Days, plus days. Now we'll go on another short break, and when we return, we'll hear our last word from our doctors. Stay with us.
Gwamnatin jihar Borno za ta kaddamar da gamayyar rigakafin cutar shan inna da kuma bikin makon jarirai game da sauran batutuwan da suka danganci iyaye masu shayarwa daga ranar Asabar 26 ga watan Afrilun shekara ta 2025. Za a shafe tsawon kwanaki 7 ana gudanar da gangamin a dukkanin ƙananan hukumomin 27. Yayin wannan mako na musamman kowane yaro dan ƙasa da shekaru 5 da haihuwa zai samu rigakafin cutar shan inna da sauran cututtuka yayin ƙuruciya. Kazalika ana ƙara azama ga mata masu juna biyu da kuma mata masu shayarwa da cewa su kasance cikin tanadin da aka samar da suka hada da mata masu zuwa awu da kuma samun kulawa bayan haihuwa gami da tazarar haihuwa da rigakafin cutar tetanus gami da gwajin cutar na mai kare garkuwar jiki wato HIV da ba da shawarwari gami da tantance nau'ukan abinci da kuma samar da kulawa ga cutar zazzabin cizon sauro wato malaria. Har ila yau an samar da sinadarin vitamin A domin lafiyar idanu da maganin tsutsan ciki da kuma sauran bukatun yau da kullum a bangaren kiwon lafiya tuni aka samar da su a cibiyoyin kiwon lafiya da aka tanadar. Kada wannan dama ta kwace mana, don haka akwai bukatar mu hada karfi da karfe domin sake gina makomar ingancin 'ya'yanmu. Dukkanin rigakafin kyauta ne, kariya da kuma inganci. Wannan sako ne daga hukumar lafiya matakin farko ta jihar Borno, World Food Program da UNICEF gami da Zeka Wiz.
Thank you for staying tuned on the program, and I believe that all our viewers have really gotten something important from this discussion this evening. If you're just joining us, I have Dr. John Allah and Dr. Musa Milton with me that are really educating and enlightening the viewers about the maternal and newborn and Child Health Week integrated with National Immunization Plus Days. Now, Dr. John, what are your final words to our mothers, fathers, caregivers, and all on the importance of maternal and newborn child?
I just want to say that, I just wanted to say that this is the period where we prioritize mothers and children. Right? They are our priority. They are the custodians of the present and the future. Okay? I will always tell people there is no adult that landed in this world as an adult. They came through a mother, they came through breastfeeding, and now they are big boys and big girls, big men and big women. So those women that took care of them, now is the opportunity to take care of the big boys and big girls and big women of the future. Yeah. This is the chance we have in the MNCH week. Okay. So please go to the health facilities to access the services.
Thank you very much. And what is your closing?
So I think I need to say that there's a disease that we have eradicated, and that's smallpox.
Yeah.
The next disease to eradicate is polio. And let us come together. We are very close to getting it done. All children vaccinated, we will get to the point of eradicating polio completely from Nigeria and globally. And no child will be paralyzed by a polio virus.
Thank you very much. Thank you very much, Dr. John, for coming. Thank you, Dr. Musa Milton, for coming. Dr. John Allah and Dr. Musa Milton.
Thank you so much.
Thank you. And we wrap up the program by saying that, remember, this is a week for every mother. So go to any healthcare facility to get these vaccines and all the benefits that they mentioned here. It is free and it is for your own health. This is where we draw the curtains on this program. Until next time, when we come your way with another interesting package on Maternal, Newborn and Child Health Week. I am Wadiam Abubakar. Thank you for staying with us. Do stay blessed and bye for now.
For ages, it remains difficult for your products, services and programs and to get the patronage you desire. Note that such programs eventually...
Borno State is conducting an integrated polio vaccination and maternal and newborn child health week from Saturday, 26th of April 2025. It will take place in all the 27 local government areas and will last for 7 days. During this special week, every child under 5 years will be vaccinated against polio and other childhood preventable diseases. Pregnant and nursing mothers are encouraged to avail themselves as other services which include antenatal care, postnatal care, family planning, tetanus vaccination, HIV testing and counseling, nutrition screening and malaria treatment will be provided. Also, vitamin A supplements for healthy eyes, deworming tablets and other health interventions will be made available at health facilities and designated posts. Don't miss out on these crucial services so that together we can build a healthier and happier future for our children. All vaccines are free, safe and life-saving. This message is brought to you by Borno State Primary Healthcare Development Board, supported by World Food Program, UNICEF and ZICAUS.
The Borno State Scholarship Board wishes to inform the public, particularly students of Borno State origin, that the Federal Ministry of Education is now accepting applications for the 2024-2025 Nigerian Scholarship Awards and Education Bursary Awards. These awards are available to eligible students enrolled in Nigerian public tertiary institutions. For postgraduate applicants, must possess a minimum of first-class honors or second-class honors, upper division, must be registered as full-time student in federal, state universities, while for undergraduate students and higher national diploma, applicants must be full-time students in their second year or above at federal, state universities, polytechnics or monotechnics. Undergraduate applicants must have a minimum of CGPA of 4.0 on a 5.0 scale or 5.0 on a 7.0 scale, while HND applicants minimum CGPA of 3.5 on a 4.0 scale. Persons with disabilities must meet the same academic requirements. Eligible candidates are required to visit the Federal Ministry of Education's website, www.education.gov.ng. Click on scholarships and carefully review the application guidelines. Complete the online application form and submit. Print acknowledgement slip for further reference. Only one application is permitted. For more inquiries on NSA and EBA, you can check the numbers below. Announcer, Borno State Scholarship Board. On behalf of my entire family, I wish to sincerely express our deepest gratitude to everyone who honored us with their presence, prayers, and kind gestures during the wedding party of my daughters. Words cannot truly capture how touched and overwhelmed we are by the outpouring of love, support, and generosity shown to us, whether you were able to join us physically or support us spiritually with your heartfelt prayers. Please know that we are forever grateful. Your companionship, prayers, and token of goodwill have left an indelible mark on our hearts. We pray that Allah rewards each and every one of you abundantly, bless your homes, and continue to increase you in goodness. From the depth of our hearts, we say thank you. We are humbled, honored, and forever indebted. May Allah keep us all steadfast and unite us always in goodness. Amen. Alhaji Baba Gana Musa, announcer.
Solidarity forever. The Nigeria Labour Congress and the Trade Union Congress, Borno State Council, cordially invite Nigerian workers, civil society organizations, employees of labor, and the general public to the 1st May 2025 Workers' Day celebration with theme Reclaiming the Civic Space in the Means of Economic Hardship. Date Thursday, 1st May 2025. Time 8 a.m. Venue Ramat Square, Maiduguri. Special guest of honor His Excellency Professor Babagana Umarazul, MNI FNS ECON, Executive Governor of Borno State. Come one, come all. Signed, Comrade Yusuf Inuwa, Chairman NLC Borno State Council, and Comrade Babayo M. Hamma, Chairman TUC Borno State Council.
Solidarity forever.
Albishirinku